Welcome, everybody. I'd like to introduce Dr. Spaan to you from Rockefeller University. I'm going to let him do his own introductions, though, and let him get started. I'm going to be putting something into the chat room. I'm going to let you guys know that we are going to save the chat so that we can grab those questions that you might have that we don't get to, and then we can send those off to Dr. Spaan, and he can answer those for us a little bit later, or maybe in a future type presentation for us, okay? So Dr. Spaan, I'm gonna stop my share and I'm gonna let you go ahead and take over, okay?
Great, thank you so much, Laura. I'm gonna put on the screen actually for the sharing, and perhaps you could confirm actually that you can see the screen right now.
Yeah.
Okay, so it's on screen. Thank you. So, hello everyone. Thank you very much for the introduction, Laura, and for having me today. My name is András Spaan. I'm an EU licensed physician specialized in infectious diseases, and I'm a scientist here at Rockefeller University in New York. So today I'll speak in this role as a scientist on the 5B- syndrome and infections. And the outline of my talk will be as follows. First, I'll introduce our team and our work. And then I will explain how we got interested in the 5B- syndrome and also why. Followed by an update on our scientific work in the syndrome. And after wrapping up, I'm here to answer your questions, okay? So I realize that I'm one of the first speakers on this year's unusual conference. So I'll try to guide you through some of the genetics that is important for our work. But should anything be unclear, please don't hesitate to ask me questions, either live or by email if you like. But also, for me, it's not a problem at all if you have a question that you'd like to ask right away on the spot during the talk, okay? So I'm happy to stop and explain as we are. Okay, so again, don't hesitate to ask anything. But first of all, who are we? And I'm working in the laboratory of human genetics of infectious diseases. This is a transatlantic scientific laboratory with two branches, and one of them is in Paris, in France, at Necker Hospital for Sick Children, and the other one at Rockefeller University here in New York, where I'm stationed at this time. As the name suggests, we're a human geneticist working on infectious diseases. And throughout human history up to quite recently, infectious diseases have had a very big impact on human lives. You can see that only up to very recently, we lost many children actually during childhood, and they basically all died because of infections with bacteria, viruses, parasites, or fungi. And not only since a couple of decades, we have access to antibiotics and other drugs that allow us to treat these infections. And this has resulted in a dramatic increase in the life expectancy for many of us actually globally. Now, infectious diseases are very interesting for a number of reasons, and one reason particularly. Despite the fact that they have been the greatest killer throughout human history, still nearly all infections are actually quite mild, meaning that still only a minority of humans that actually die because of these infections. In other words, mild infections are the rule, while death is rather the exception due to infection. And the big question is, what accounts for this variability in between humans? So why does actually one person die because of an infection, while the other person barely has any symptoms of the very same bacterium or virus? And this is where human genetics jumps in. Because it has been observed for quite a long period of time that infectious diseases have a very strong human genetic component. And here I need to explain a little bit of what genetics is and also what genes are. So our genes are made of what we call DNA. DNA is what you can see here, and the DNA together makes something into a gene. And our genes are made up of what we call DNA, which we inherit from both our parents. And these genes, they contain the inherited information to build our body, so to say. And our body has nearly 20,000 genes, so that's many of them, which are essentially stretches of these kind of DNA, which we all collected in different books. So the genes are collected in a different set of books, which we call our chromosomes. And these chromosomes we have 23 pairs. And from each pair of chromosomes, one copy is inherited from the father, and the other copy is inherited from the mother, and that together makes up a new individual, the child that's born out of this father and mother. Now, some infections, move on to the next slide, some infections like appendicitis, which is a very common disease, but also tuberculosis, are known to run within families, and are likely based on a genetic predisposition to these specific infections, meaning that these infections, having them is not just bad luck, but it's actually written in our genes. And this we can read from pedigrees like these, where there's different family members across different generations that have the same disease and that actually pass on these genes that predispose them to the specific infection. Now, the head of our laboratory, Professor Jean-Rocque Casanova, he has dedicated his life to unraveling this genetic predisposition to infections. And he has actually shown that many infections, life-threatening infections, are essentially inborn errors of our immune system, what we call it. So basically inborn errors of our defense mechanisms against these bacteria and viruses and parasites. And that these inborn errors are encoded in our DNA, meaning they're encoded in our genes, and that makes them genetic diseases. And over the last 3 decades, so that's about 30 years now, Jean-Rocque Casanova has shown that human genetics explain why some people suffer from a life-threatening disease, while most people have a very mild infection only. Meaning, suffering from a severe infection is not just bad luck, but it is written in our genes. And this has been very important as it has allowed us to better understand what infectious diseases actually are, how we can diagnose them, how we can counsel families in which these infections run, and what it means in terms of prognosis, the outcome of such an infection, and how we can better our treatments for the patients that are affected by these infections. So in this way, we've been able to identify specific genetic, meaning inherited, holes in the immune system for various diseases like tuberculosis, yeast infections like Candida, but also to bacterial infections like the pneumococcus bacterium and the staphylococcus bacterium, which are very, very common bacteria that most of us sooner or later encounter, but not everyone gets a very severe disease. And most recently, we have also expanded our work on viral infections like COVID. And I just wanted to show you, not that this is directly related to the 5p- syndrome, but I need to show you because it shows our capacities actually of our team that we're working with. Because in response to the current pandemic with the coronavirus, our team has quickly set up a global consortium trying to find the answer as to why most of us have only very mild infections with this coronavirus, while some of us actually die. And the people that die, this is what we see on the television, the hospitals being overwhelmed. But in fact, the vast majority of people have only very mild infections, if they have any symptoms at all. So we really needed to understand what predisposes those individuals either to a mild infection or to a very severe outcome. So as of today, our work on coronavirus and the genetic predisposition to this very severe disease is in press, and it will appear very soon in the journal Science that perhaps some of you may know of. And that's going to be somewhere in the upcoming weeks, which you can probably hear of more from soon. So again, I'm just showing you because our lab is quite strong in unraveling these kind of diseases. And I just wanted to show you, but not because it is directly related to the 5p- syndrome. What we typically do in work like this, but also in the work that I'm going to tell you more about, is learning from families with patients who suffer from severe infections. And by learning from these families and by studying their DNA containing their genes, which are together collected in the chromosomes, So by studying these families and studying their DNA, we identified genes that contain very small, apparently very small mistakes in the DNA that we think could make this gene work less well compared to healthy people. And then in the next step, we try to prove this defect by performing a lot of very complicated, fundamental scientific experiments for which we need very sophisticated and advanced techniques. But together, these two things, they allow us to understand what may go wrong in these patients and what makes them so exceptionally ill in response to an infection. But also it allows us to identify new and previously unknown ways to treat these affected patients. So at the Rockefeller University, we had collected some time back a number of patients with very specific infections of the lungs and skin. And we tried to see if there was anything in their genome that they had in common. Meaning if there was some kind of a genetic defect that these patients connected to each other than the infections in themselves that they suffered from. And it turned out that there was one gene with a very small mistake in its DNA that was shared by multiple patients. And that's the red gene right here. But this gene, it is located on the short arm of chromosome 5. You can see it highlighted right here on the left. And our patients had only one healthy copy of this gene, while the other copy of the chromosome was affected. So to say, I'll show you here, they had about 50% left of the activity of this one single gene, one healthy copy on one chromosome, but one copy with a defect with a mistake in it on the other chromosome, meaning about 50% activity of what normal people have in a normal healthy state. And as I said, these patients, you can see them right here on the left, their pedigrees, they suffered from severe infections of their lungs, meaning they had pneumonia, as we call it, but also of their skin. They had skin infections quite recurrently. And some of them, unfortunately, died, these two individuals, as you can see here, due to the infection. But most strikingly, these were mostly bacterial infections that the people suffered from. Meaning, apparently, they did not seem to suffer mostly from virus infections, but from bacteria mostly. Now, as I said, this gene, it is located on the short arm of chromosome 5, meaning that depending on the breakpoint, the vast majority of individuals with 5p minus syndrome have one copy of this gene left as well. And I'll come back to that, because we know a little bit more about this gene that is located on the short arm of chromosome 5. We know that when you have two working copies of this gene, here in blue, it means there's two gene copies, there's normal function of the both genes, and it is what we see in a healthy condition. When both copies of this gene, but the rest of the chromosomes are fine. But when these two copies of the gene are affected specifically, there's 0% activity of this gene left. And these patients, they suffer from very severe but spontaneous inflammation. So that is what happens when the chromosomes otherwise are fine, but when this specific gene is defect in both its copies. And then, as I said, in our own patients, when there is only 50% of gene activity left, it results in predisposition to infections. Now, the gene, again, is located on the short arm of chromosome 5, meaning that depending on the breakpoint, the vast majority of individuals with a 5p minus syndrome have only one copy of the gene left as well, meaning that, similar to our patients, they also have about 50% of the activity of this very specific gene left. And this is what brings us to the 5p minus syndrome, which is, in a way, it is a historical coincidence, as the 5p minus syndrome was originally discovered in the 1960s by Jérôme Lejeune, who was a French geneticist working at Necker Hospital for sick children in Paris. And this is also the place where we now, more than half a century onwards, got involved in this syndrome, because Jean-Laurent Casanova is not only a professor here at the Rockefeller University, but also at Necker Hospital in front. And historically, the scientific interest in the syndrome, in the 5p minus syndrome, has mostly been directed towards the behavioral challenges that many of you deal with. And not so much effort, however, has been put in understanding the more medical, like the physical challenges that you also deal with and that affect a lot of individuals with the 5p minus syndrome. What we do know from very old studies, you can see here from the 1970s, it's pretty old, is that although the life expectancy, fortunately, has been increasing over the last years, we know from old studies that airway infections are a major reason of hospitalization in 5p minus syndrome, and also that infections of the lungs, like pneumonia, actually are a major cause of death in the life of individuals with the 5p minus syndrome. So altogether, reasons enough to consider the involvement of this specific gene we have been working on in our own patients in these infections reported in the 5p minus syndrome. So here is where we asked the 5p minus syndrome society for help, as we felt it was needed to prove this concept scientifically by studying a number of individuals with the syndrome in great detail and to compare their samples to that of our own patients. And we're really extremely grateful both for the society as well as for the individuals that have reached out to us to participate over the last year, as it has all happened over the last couple of 12 months more or less. So first of all, in these people that visited us, we made a very precise breakpoint determination. And a breakpoint determination that is actually telling you something which part of the short arm of chromosome 5 is deleted in these individuals. And this is the short arm of chromosome 5. This is where the gene is located that we are working on. And these are the breakpoints of all the study participants that visited us in New York. And you can all see that all the participants had only one functional copy of this gene left in their DNA. And so we confirmed that they have indeed only one copy of this gene we're working on. And then we, of course, talked a lot with people that came here, and we performed some studies actually in seeing how their samples behave when we would compare them to those of our own patients. And we learned, quite shockingly actually, is that indeed this proof of concept holds true. We have learned that the samples of those individuals that have visited us at Rockefeller, in our testing systems, that they behave very similarly to that of our own patients. And the technical details will require too much actually to go into much detail right now, so I will not bother you with that. But what I'm showing you here in the box columns from the 5p minus syndromes individuals that visited us, that they cluster quite closely and seem to be quite related to those of the other patients that we study in our own hospital and that suffered from these infections is the reason for visiting us. And this is quite different from the samples from healthy controls that were included as well, which are on the far right. So you can see that the fingerprint in these pictures is quite different for the healthy controls as compared to our patients, which are similar to the samples of the 5p minus individuals. So even in more depth, and I know the slide is perhaps a bit small and the colors may not appear well on your iPad or your screen, but I hope you may be able to see in these pictures right here on the right lower end of the slide that there are some white dots, very bright white dots in the pictures. Right here you can see them, here you can see them, but also here you can see them. And I hope you can also see that in these two samples, these white dots are not present. But these white dots, they're actually the consequence of the working of this gene that we are investigating. And in healthy controls, where there is 2 copies of this gene at work, there is barely any white dots. While when there's less copies of the gene at work, there's an accumulation of those white dots. And these white dots are a direct consequence of what the gene that we're studying is actually doing. So we think actually that we can directly link these white dots to the function of the gene, like in a normal healthy cell. Now the interesting thing to us is that the precise breakpoint of the deletion in the 5p minus syndrome, as we determined here, as you may or may not know, this breakpoint is quite variable between individuals with the 5p minus syndrome. So for the gene we are working on, this means that about 90% of the individuals with the syndrome indeed have only one working copy of the gene. Meaning, I'm going to go back one slide to show you that 90% of the individuals with the 5p minus syndrome, they look very similar to what we are showing you right here, meaning they have only one functional copy of this particular gene. However, there is about 10% of the individuals with the syndrome we know from literature that have a somewhat smaller deletion. And I've tried to visualize that here on the right part. So they have a somewhat smaller deletion, leaving them, although they have the syndrome, the 5p minus syndrome, leaving them still with two regular copies of the gene that we are currently studying, just like nearly all other individuals that we are, in a healthy state that you and I may look like. So again, 90% of the individuals with a 5p minus syndrome have only one copy of this gene, and this genetically looks very similar to our patients with infectious diseases here at Rockefeller University. However, 10% of the individuals with the 5p minus syndrome have two regular copies of the gene, just like nearly all other individuals, except that they still lack another piece of the short arm of chromosome 5, making them having the 5p minus syndrome. And this is very important, because now that we have delivered this proof of concept, that there's a lot of similarities actually between the patients that we study at Rockefeller and the 5p minus syndrome, our work in unraveling the actual mechanism, that is still ongoing. And particularly, we'd love to get to know people with the syndrome that have these very small deletions only, meaning that potentially they could indeed have two normal copies of this gene. And we suspect that their cells may behave normal, other than the cells that we have studied so far. And also we would love to hear about their history of life, actually, what their history of life tells us in terms of, for instance, infections that they may or may not have suffered from. So this altogether is quite important for putting the syndrome better on the scientific map. And I hope to convince you that our laboratory and our team is pretty capable of doing so. So another question we're currently facing, and this is of course super actual, is how does this all translate to COVID? And I'm aware this will also be an important question for you. And a clear answer at this stage is difficult to give, unfortunately. And for this reason, particularly, I would love to hear what your experience is actually, and what family members that have contracted the virus and did or do not develop any symptoms, how you have experienced the time so far over the last 6 months. This is important for us to learn about, but I guess it's also important for you as a society, well, to get a clear picture actually on how COVID and the coronavirus is affecting everyone. But before doing so, I'm going to wrap up at this time. I'd like to thank everyone involved, particularly the members of your society that have been willing to participate in our study and to come over to New York City. But of course also the society in itself with the scientific and the executive boards. So thank you very much for your willingness to collaborate here. This has been extremely helpful and extremely important to us. For this time, thank you very much for your attention. And as I said, I'm here to answer your questions that you may have. And I'm very happy to take any question. I'm not sure if I have all the answers, but I'll try my best to provide you. Okay. Thank you very much.
Thank you so much, Dr. Spaan. It's so wonderful to have you join us, and thank you for providing us with that information. We did have two questions come in And you may have answered them during your presentation, but one of them asked if you know what the name of the infection protection gene is and where it is located on the short arm of the chromosome.
Yeah. So excellent question. Actually, I see it here in the chat. Indeed, what the name of the gene is. So the name of the gene, it has a beautiful name for us to say. It is called otulin, and otulin, well, that's the name the gene has been given. And otulin is mostly known for this disease that I mentioned, in which patients that have small defects on both of the copies of this gene, and they basically have 0% gene activity, but otherwise normal chromosomes. These patients suffer from a very severe inflammatory disease, which is not what our own patients have, and also not what we see in the 5p minus syndrome, because what we see in our own patients and in the 5p minus syndrome is that 50% of the gene activity likely predisposes to an infection rather than to the spontaneous super severe inflammation that is seen in these patients that have been described with 0% gene activity of this gene named otulin.
And how do you spell that?
Yes, so I can reply it in the
Okay.
chat if you like. Perhaps that's easier. This is what it is called. That's now in the chat, and you spell it O-T-U-L-I-N.
Okay, thank you.
So it is a great question, and we're still having work in progress. Now, I would like to ask you to keep this name just within the walls of your room, because this is important in terms of the work that we still need to do to really validate our findings. And we have been able to make this proof of concept that I was just talking about, that the patients with a 5p minus syndrome that have only one copy left indeed look alike a lot of our own patients here at Rockefeller. But for the full proof, to really make the full circle of proof clear, what we would actually need is a sample or one or more individuals with a syndrome, but with a very small deletion that have still 2 copies of this gene at work. And that is one of the important things that still need to be unraveled. And this is also why it is still work in progress, and why I'm happy to tell you all about the gene, but you have to be aware that this is scientific work on the go.
Great, thank you so much. Another question came in, is it possible for us to determine how our child is affected with 1 or 2 copies through a karyotype?
So first of all, the karyotyping will give you a good information on the breakpoint. So the karyotyping, for the ones that may not be completely filled in there, that is a traditional way of determining deletions in a chromosome. But also it is a very crude technique, basically, to see big deletions or small deletions. And these days, there are more sensitive, newer techniques, basically, that can really narrow down precise breakpoints. And roughly, big deletions, they can be detected by karyotyping. That's a traditional karyotyping. And the deletions detected by traditional karyotyping, typically they're big enough to include also the gene we are working in. But now for the people with a small deletion, we're talking about more subtle deletions. And these may require more, well, let's say modern day chromosomal techniques actually that are worked with these days. Yeah.
Okay, we have another question that came in. Does having an unbalanced translocation and IgA deficiency create a higher risk of severe infections?
So yeah, that's yet another question actually. The unbalanced translocations, that is one of the things that we're currently investigating. Now, traditionally, IgA deficiency, that is what we call one of the well, let's say primary immune deficiencies. That's how they label that. And IgA deficiency in general predisposes individuals to a slightly higher risk to particular infections. But the mechanism, or the reason why so, and also the type of infections affecting these individuals, that is slightly different from the role of the gene we are currently investigating. So we're talking about infections, yes, that's true, but the type of infections and the manifestations, those are different.
Okay, thank you. Let's see here. We have someone asking how they can participate in the study. What would you like them to do and how? And what types of samples are you taking?
Yes, exactly. So first of all, thank you very much for everyone who would be willing to participate in our studies. As you have seen, hopefully, and I hope to have convinced you that over the last year, with the help of the families that have visited us here in New York City, we have really made a huge leap forward actually in understanding both the 5p minus syndrome, what is actually happening in the bodies on a medical level, but also it has helped us a lot in better understanding our own patients. So why it is so important that those people who have visited us is because we have learned really a lot, and it will help us also for future generations actually in order to better understand what they can expect. But also there's ways that we anticipate it may be helpful in optimizing treatment should someone have an infection. This is still far away, but at least we have made really big steps in getting there. So we're very grateful to anyone who would be willing to participate. And I see from the corner of my screen, actually on one of the profile pictures, I see my own face, not live, but with one of the study participants. And it has been really a delight of having you over here. And not just because we are very thankful for that, but also because we enjoyed it having you guys here. And it was really, well, a very important and valuable experience to all of us. So thank you very much. What do we ask for the people to participate? Well, basically anyone could participate. So anyone could participate. What we have proposed to the people like over the last year is to come over to Rockefeller University, and we can arrange your itinerary, but also your stay over here at Rockefeller. We will take care of that. And during this visit to our university hospital, which is a small research hospital, we would take an interview with you, and we also would like to take samples, because these samples are the essential information for us to make the studies that we need to do. These samples contain both a blood sample as well as a small piece of skin. And this small piece of skin is basically the size of a ballpoint from the superficial skin layer. And this we need to take the cells actually and to run the studies that we do. And that is essential to our studies. So this is what we basically do in a nutshell. And the Rockefeller University Hospital is a dedicated research hospital. Has really the highest standards in terms of ethical regulations. So all our studies are ethical board approved, and this also includes the studies that we do in the 5p minus society in members, because of course individuals with 5p minus syndrome are different in many ways actually compared to our regular study participants. So our team is really dedicated also to the 5p minus syndrome in terms of dealing and handling and making you comfortable while you are here. So I hope that's a bit of an elaborate answer, but the bottom line is we would really love to hear from you. I think the easiest way of reaching out is by emailing me, and for this I will reshare my screen briefly so that you can see my email address on the top, which is right here. And I think that would be the most easy way to reach out. Also, I think, Laura, you have my email address. So worst come to worst, I think if you reach out to Laura, you can forward it, connect it. Okay, so that's a question to how to participate. Yes.
Great, thank you so much. We have another question here. Can the gene deletion be detected by FISH analysis? Is there a probe for FISH for that gene?
Yes, so the fish analysis is again, that's one of the more modern techniques actually, and the fish analysis is very sensitive, and for us it's sensitive enough to have a good know of what the deletion of this individual would be like. Nevertheless, in any individual that visits us, we do like let's say a super precise breakpoint determination. And this is not in a diagnostic setting because, you know, for diagnostic tests, there's different ways. These are scientific tests that we perform in the context of this study. And this is like a super precise, but it's not, let's say, an FDA diagnostic test that we would do. So fish analysis is super great. It's very informative, and it will tell us the breakpoint. Irrespective of that, in all our individuals, we do this, let's say, next generation breakpoint determination.
Okay, great, thank you. Would an interstitial deletion make it more likely to have both genes?
Yes, that is a great question again. And indeed, we think that if there is anyone with an interstitial deletion, well, it's pretty likely that this individual may have two normal copies of the special gene. So if that were to be the case in your family, we would be really looking forward to hearing from you.
Okay. So I know you got to meet Aaron, and that's who you're in the picture with from the Watts. Danny has a question for you. Can any of your early findings be translated into care for our children, advice to our doctors as they provide care for our children?
So thanks, Danny, for your question, and thanks again also for coming over to Rockefeller last year altogether. That's a great question because this is ultimately what we strive for, right? I mean, we really hope to be able to improve the life of the 5P minus syndrome individuals and also our own patients here at Rockefeller. And this is really what Rockefeller does, science for the benefit of humanity. That's our motto, and this is really also the key of our studies actually, related to the gene that we're investigating. So at this stage, we do have the first proof of concept, and that is a major breakthrough. But in order to really get into the final proof, basically, there's more studies that need to be done, which are pending. And thanks to the studies over the last year and your participation, we have been able to make these steps forward. So what we hope to do in a couple of upcoming months is actually to perform additional experimental tests that will show us in more detail what is actually going on, and also to nail it down what the context of the specific infection does. So how the infection triggers the body, for instance, 5P minus syndrome individuals to make the infection perhaps more severe. And this is the proof that we really need to have, and that we have a couple of big steps, but they are still preliminary. And I really hope this will be able, we will be able to make full proof in the upcoming few months. However, I must say that over the last 6 months, like everyone, we have been forced to redirect a lot of our attention to COVID and to the coronavirus. So I wish I could have made more progress actually on this specific part because it's super essential. But pandemic some way got a little bit in between.
Yeah, and in regards to that, do we have an idea of how many people with Cri du Chat have COVID? I mean, we haven't had that many people tell us in the society that they have, but have you encountered very many?
Yeah, so thank you again, Laura, because this is an important question that we have at this stage. And for so far that I've heard from people, I have not heard of any 5P minus syndrome individuals that suffered from a severe coronavirus infection, meaning that they needed to be admitted to the hospital or even ended up being admitted to the intensive care unit or even worse. So I have not heard of that. And Also, Laura, it is my understanding that you have not heard of such cases as well. So I would really like to ask you, the whole society and all the people that are currently in this call, if you have heard of any of such cases, please do let us know. Let me know or let Laura know. It can be completely, anonymous. You don't need to identify yourself. And we need to have this information because it's essential actually for all the other people with the 5p minus syndrome. But so far, what we have learned is that it appears to us that also 5p minus syndrome individuals are not necessarily more susceptible to these kind of viral infections, like the coronavirus. And this is reflected by the fact that we don't see so many. We have not heard of very severe cases with coronavirus, but it seems like individuals with the 5p minus syndrome may have like these infections of their lungs, mostly due to bacteria, which is something different than a virus. So it seems there is a difference actually in susceptibility to virus infections rather than bacterial infections. Let us know for the coronavirus. This is really important information to all of us.
Sounds great. Thank you so much for that. Another question here. We've got probably time for a couple more questions. If there is skin impact, do you anticipate this may also contribute to the digestive disorder seen in 5p minus?
Yeah, the digestive disorder, this is yet an excellent question actually. The digestive disorders in 5p minus syndrome, we do not understand fully. And there's different thoughts on it also in traditional ways. So there's a lot of people that suggest the 5p minus individuals may suffer from obstipation more often than other individuals. At this stage, we don't know yet actually if this is the full picture, because it seems at least our patients here at Rockefeller University that a significant number of them also have what we call inflammatory bowel disease, meaning they do not necessarily have obstipation, but they have an inflammation of the gut, which is mostly induced by bacteria that other people do not so much care about, that do not have a reaction on that. But it's this inflammatory response actually that gives them the disease. And interestingly enough, I just learned about a case in the United Kingdom of an individual with a 5p minus syndrome that also suffers from this combination of skin and inflammatory bowel disease. So also if there's any amongst your members actually with individuals suffering from these inflammatory bowel disease, please do let us know.
Great, thank you so much. Okay, so I have one more question here. Where is other work being done to study 5p minus, if you know? This is from Adela in Colombia, and she says she belongs to a group of 104 5p families in Latin America and Spain, and so far none of our children have been reported with severe COVID-19, which is good to know because neither have we, right, here in the United States. Do we know which is the most common death caused by a 5p minus person?
Yes, thank you very much, Adela and Laura, for forwarding this question there. It is an important question. Thanks also for joining from Latin America. That's great. Thanks for being here today. So, what we know, indeed, your impression in Latin America regarding COVID and the 5p minus syndrome, it seems to be consistent with what we have learned so far in the United States. Okay, that's one. Do I know of any other work being done to study the 5p minus syndromes? That is basically, I have not heard of many universities or medical centers that have a real focus on the 5p minus syndromes. And that's a problem. And that's a problem for two reasons. First, it is a problem because there's barely any centered medical expertise on the syndrome. And this is really affecting you all because sometimes it's hard to find someone that has seen the more than one single case during the medical life of this doctor that is seeing you. So that's a bit problematic actually. But also on the medical understanding of the disease, what is actually happening in the bodies of individuals with 5p minus syndrome. there's very few scientific interest in it, and it has a lot of historical reasons. And we are trying to change that. And we're trying to change that because we feel it is super important, not just for the 5p minus syndrome, but also for these individuals with genes located on the short arm chromosome 5, for where there may be many more patients with problems that look similar to the individual with the 5p minus syndrome, and that may be actually better be treated. So that's in a nutshell the answer. There is no centered or centralized medical scientific investigations on it. And this is also why we feel it is important to put this on the map. And this is what we're currently doing so. So the most common causes of death, which is the last question of Adela in Latin America, and the most common cause of death in 5p minus syndrome individuals, this is what we have to learn from all scientific reports, because nowadays there is not much really investigational science going on. What we have learned from these old reports is that actually respiratory tract infections are a major reason of hospitalization for individuals with 5p minus syndrome. That is one. And then respiratory tract infections of the lungs and the inflammatory response following that, that is one of the major causes of death in 5p minus syndrome individuals. What has to be said though is that those are old studies, with all disadvantages of having old studies, and that fortunately across the time the life expectancy of individuals with the 5p minus syndrome has improved dramatically. And this is also because of modern medical technologies and the advent of antibiotics, of course, to treat those infections. But it seems indeed that those infections are a major cause of death.
All right, well, thank you very much. Does anybody else have any questions? If you do, if you want to unmute yourself or ask to be unmuted. I think maybe we can do one or two more, but we've got to probably close it down so we can move on to our next, get set up for our next two speakers. Again, I apologize for the passcode situation only because when we tested it out, it didn't require a passcode. So I'm not sure why some of you need to have a passcode when you click that link in the agenda area, and some of you don't need to have a passcode. So I'm not quite sure what that is, but I have put for the next two presentations on the wall passcodes. So please seek those out on the wall if you are in need of them. So did anybody else have any other questions for Dr. Spaan? I'll give it a second. Oh, I have one here. Dr. Spaan, thank you for your work. Oh, thank you. Yes, Dr. Spaan, thank you so much. And this has been recorded, so we will, after it's done and we get the link, we'll go ahead and also put that in the agenda next to Dr. Spaan's presentation on the agenda. And then that way, those of you who you can see it again, or hopefully people who weren't able to get in will be able to see it. Dr. Spaan, thank you so much. We just greatly appreciate it. Did you get your swag bag?
Thank you so much for being here today with us, and also for listening here and being involved actually. And thanks again for the society for your willingness to participate, but also to all the individuals that have been willing to come over to New York City. This has been really a great experience for us, and thank you so much for that. All
righty, thank you. We're going to go ahead and close down the meeting, and then you guys can head on over to either guardianship, if that's what you wanted to go to, or the physical therapy presentation with Dr. Abuzizi. All right, okay, bye-bye now.
Thank you, everyone.